line is where we are post-update. It follows a similar trend. The numbers aren't precise, but they're not substantially off, 7.6 to 7.5. When you look back on July 25th, 7.2 versus 7% around the beginning of August. But bottom line is the trend line is as we asserted and as the hospitalization number and the ICU numbers suggested. And that's an encouraging sign, again, even when you include the positivity rate with the backup. You can get a closer look here. This looks more like an EKG chart than anything else, and this could confuse anybody, but you get a sense of, where we thought we were doing a little better when we announced a few weeks ago than we were, and it looked like when you start adding all those backlogs, we're looking a little worse. The bottom line is we're smoothing all of that, and we have reconciled all of that. So where does that leave us? If you add all the backlog cases over a 7-day average period, they're at 9,446. Typical case number when you add the backlog over a 7-day period. The numbers that we put out today are the latest numbers, 6,469 positive cases in this state. Those case numbers are high, but they are trending in the right direction. Let me be more specific and more precise. We are now averaging close to 134,000 tests every single day here in the state of California. 133,632 is our average 7-day daily number of tests we have conducted. The percentage of people that have been tested over the course of the last 14 days that have tested positive for COVID-19 is 6.5%. So our positivity rate over a 14-day period in the state of California is 6.5%. Accordingly, we've suggested this in the past and we've asserted it, but the positivity rate, again, stabilizing and moving broadly in the right direction, also connects the expectation that we'll see hospitalizations to continue to decline. The good news is they have been declining statistically, and as a consequence, we have experienced a 21% decline in hospitalizations over a 14-day period. So 6.5% positivity, all the backup numbers included, updated numbers on hospitalizations, down 21% over a 14-day period. By the way, we're now at 7% of our healthcare system capacity represented with COVID-19 positive patients, 7%. As it relates to ICU admissions, we are down 16% over a 2-week period. So again, hospitalizations as well as ICU admissions trending in the right direction. We now have, I think it's roughly 19%. In fact, let me confirm that it is 19% of our ICU admissions are represented with COVID-positive patients in our ICU healthcare capacity. But again, hospitalizations trending downward, ICU numbers now also trending downward along with the positivity rates here in the state. Let me update you on the monitoring list. Last monitoring list you saw was on August 3rd, and this was the 38 counties out of our 58 counties that were included. The new monitoring list we're putting out today now has 42 counties on the list. Again, you have to be on the list for 3+ days, or rather you appear on this list as long as we see trends over a 3-day period. You pull off if we see 3 days of trends holding stable as well. So we go from 38 counties to now 42 counties. Let's get underneath, look at which counties were added and which county was removed. You'll see that Amador and Mendocino counties were added, and this is the first in the day. We went back to 7/25, and Amador was 2 days on. Mendocino was 2 days on, officially went on that 3rd day. I want to just applaud the leadership in Mendocino. They didn't wait for this updated information. They made modifications to their stay-at-home order. I want to thank their health officer and their county board of supervisors, among many others, for their leadership in this space. So Amador, Mendocino, you see Inyo County, Calaveras, and Sierra. Sierra just joined the list over the weekend, Calaveras on Thursday. Santa Cruz on Friday was removed from the list. So we've said this in the past. You've seen this in the past. This is a dynamic list. People come on, people come off. The numbers shift every single week. And I anticipate this week the numbers to shift again. It looks like, all things being equal, and the latest reporting period, 24-hour reporting period, which we will have later this evening, it's very likely San Diego will join the list of those counties removed. So likely tomorrow, though we'll update this, likely tomorrow that you see San Diego on that list. But Santa Cruz is currently the one county that was removed from the list. So this is an updated monitoring list. And I encourage people want to learn more about the monitoring list, want to get under the hood, understand the criteria that leads to how you end up on it and how you end up off it. Go to covid19.ca.gov, covid19.ca.gov. For more information, you can toggle and actually go to your county and learn with some specificity exactly how your county is doing and get a sense of the prospects based on the trend lines, the encouraging trend lines on hospitalizations, ICUs, and positivities, case rates, the likelihood that your county may soon come off that monitoring list. As always, we can't ever have a presentation where we don't encourage you to continue to do one of the most important things you can do to mitigate the spread of this disease, also mitigate the prospects that we'll have to extend these monitoring counties and see our schools reopened. That impact can be substantially made by your commitment and resolve to wearing a mask. Physically distancing, always one of the most important non-pharmaceutical interventions that we can make, and washing your hands, minimizing mixing where you can. And so that is a slide very familiar to those that have taken the time to watch our presentations. I want to just conclude by reminding you of how deadly this disease continues to be. Over the course of the last 14 days, we have averaged, over a 14-day period, the loss of 132 lives on any given day, which is just jaw-dropping when you consider that. And so our heart goes out to every single family that has been torn apart because of tragic loss of a loved one. And I also want to extend just my personal respect, my deep, deep admiration. I had a privilege a few days ago to have a meeting with a number of doctors, a number of nurses, some ICU nurses that talked about being at wit's end and how emotionally exhausted they are, not just physically exhausted they are. But nothing was more impactful to them and to me than the issue of loneliness that they described with loved ones that are in an ICU, intubated, likely to lose their lives, but cannot see a loved one, cannot see the hand reach out to say, I love you and I'm going to miss you. The impact on that, the impact on them, so profound. And I just want folks to know, none of us, for the grace of God, any of us, end up in that circumstance, end up on the other side of this equation. And that's why it is so important. It's so important that we take the responsibility to do a little bit more and a little bit better with wearing a masks and trying to do what we can to minimize mixing. They described, one of the nurses described buying extra iPhones so their loved ones can see their loved one in an ICU. The only way they could see them is virtually. Others described, all but being there as, well, the only one swaddling a young child, singing to a young child because a COVID-positive mother can't even breastfeed. A COVID-positive mother can't even hug their child. That bonding experience, that human experience. Forgive me for belaboring this, except to say people are still dying from this pandemic. Don't be misled by the 18 numbers, the 18 people that we advertised today that lost their lives. We send to see these on Monday, the data from the weekend. 132 human beings losing their lives in an average day over the course of the last 14 days. This disease is deadly. Take it, please, please, take it seriously. And if we do continue to, we will be back in a modified world, at least in the short run, until we have a vaccine, higher quality therapeutics, and we can do that much sooner, much faster, if we continue the course that we're currently on. So with that, happy, of course,